morning. Welcome to the show. This is Momentum today, the 3rd of March. And our topic today, as we were talking earlier on, with regards to our interview in the second hour of the show, well, different days, different themes from Mondays right up till Thursdays. And on Monday, we started off with health on Traxx. Thank you so much to my producers in the studio. I got Zam, Achu, and thank you so much to... Yes, Azura, who is on our vMix right now. So if you have probably a question or you would like to ask anything to our good guests in the studios right here, please go ahead. We are live on TikTok, not forgetting for Facebook, and also on our TRAXXfm official Facebook page. That's TRAXXfm. So keep it locked in right here on the show. A very interesting topic today. And while we'll be talking to our guests in the studio, Professor Dr. Tan Mo Pin, who is the head of Geriatric, the medicine unit from Universit Malaya Medical Center, and while living with dementia. This is a very important topic, as I said earlier on, and a very interesting one, especially for those of you who probably might know somebody who is having these problems. And well, the good professor, our guest in the studio, will be at least explaining to us a little bit more on our topic for today. Now, just to let you know that dementia is or happens to be a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to, well, get into our lives or interfere in our daily life. Now, Alzheimer's is the most common cause of dementia. So getting into our questions, but just before that, we would like to get to know our guest in the studios, Professor Dr. Tan Mo Pin. And a very good morning to you, Professor. Professor, could you just tell us a little bit more about yourself and, well, probably a little bit of what you do as a profession?
Yes. Good morning, Gilbert. And thank you very much for having me on the show.
You're welcome.
So geriatric medicine sounds like a mouthful.
Oh, yeah.
And a lot of people don't know what it is, but some people are starting to consider geriatric as a derogatory term.
Okay.
But actually, we are basically looking after older adults. So older, we tend to use an age cutoff,
Okay.
but actually it really depends on biologically how far you have aged.
Okay.
But usually about 66 to 5 is what we say you're old. And older people tend to have a tendency to accumulate medical problems.
Okay.
And then they take many medications. And so when they come to hospital, they often have a lot of side effect to their medications, and the presentation tends to be very non-specific. And therefore, the geriatrician has to actually be able to be more of a detective, a diagnostician.
Okay.
And then management can be tricky because they've lost the ability to care for themselves.
Mm-hmm.
So you need to do rehabilitation and also plan their discharge home such that any needs of theirs is properly met, so that they don't suffer any long-term, as little long-term negative effects as possible.
Okay.
It's a very complex subspecialty.
And it's, well, I should also say that many, as you say, when they age, right?
Yes, yes.
And this is something which is very common.
Yes.
So that's overall on how common it is actually, Professor, dementia.
Dementia.
Yeah.
Yes, so dementia, according to our National Health and Mobility Survey, which was done in 2018, 1 in 12 people over the age of 60 have dementia.
Okay.
And we do know that people with dementia, from the time the disease has occurred, can live for 8 to 10 years. So there are a lot of people with dementia hanging around in the society. And when they have dementia, they're more likely to need care, hospital care, and also care in care homes. So when we talk about hospitals, we've done a survey in the Universit Malaya Medical Center. 1 in 4 people over the age of 65 who come into hospital actually have memory problems. We call it cognitive issues.
Okay.
And when we look at the over 80s, we're talking about 1 in 2. So more people with who are over 80 who come to hospital have problems with their memory compared to those who haven't.
Okay.
So and when we look at care homes, long-term care, nearly all residents in a long-term care facility in a nursing home will have some degree of memory issues.
Okay. When you're talking about this one here, it's not in our question. I like to get off my sheets sometimes.
So do I.
Doctor, well, mom takes this. Well, it's like a vitamin, all right? To enhance cognitivity
Yes.
or something like memory, right?
Yes, yes.
Can things like this help, doctor?
Okay, it really depends. Yeah,
To prevent.
Yes, it really depends. So generally off-the-shelf supplements, we know that really there's very little evidence that they will reduce the risk of dementia.
Okay.
What we really know is the way you live, your lifestyle. And we know from the recent Lancet Commission report that 45% of risk factors for dementia are potentially modifiable. And most of these risk factors occur at midlife, so between the 40 to 60s. So a lot of us who are living out there before the age of 60 actually need to watch what we do. So there's only one risk factor that is still left in the group that says late life risk factor over 60, and that's social isolation. The rest of the risk factors are majority of them are what you do, how you behave in your midlife. So and those involve risk factors such as high blood pressure, diabetes, sedentary lifestyle, smoking. So those are common risk factors that we know also lead to a lot of chronic diseases, and they also lead to an increased risk of dementia. So it's how we behave in midlife. And so all those supplements, whether they do any good or not, I can't say no. But even if they do, it's not going to be it's not going to be the one that really reduces your risks.
Okay, because if as what you mentioned, Professor, this is things that how you live your midlife.
Yes, that's right.
Very important.
Very.
So it's not just taking those supplements to.
Yes. And we say it's a life course approach, isn't it?
Yes.
So if you risk factors such as educational risk factors. So for childhood, you really need to look at education, prevention of head injuries. I think there's been a lot of things in the news about how these American footballers have an increased risk of dementia, chronic traumatic encephalopathy. So what we do see is if someone has a motor vehicle accident in early life, that will really increase the risk of developing dementia in late life.
Wow. Okay, that's surprising. It's not just something that we pick up just because we're getting old or we're aging, but it's also, as what you said, lifestyle and also damages that has happened in the earlier stages.
Yes.
All right. How does actually dementia happen, Professor?
Okay, so the dementia is actually a problem with the brain. And so when we actually dissect the brain of someone who has died of dementia, we will find that there are these plaques called amyloid plaques.
Okay.
And in the microscope, you also see neurofibrillary tangles. So those are the pathological issues that happens.
Okay.
But we won't be able to know until we actually dissect that brain after the patient have died. So what we do know when we notice from day-to-day life is that we do know now that even because we know that dementia, you can only diagnose it when they've lost the ability to look after themselves on a day-to-day basis.
Okay.
But even years before this happens, so we might notice some behavioral issues. The person might start becoming more impulsive, more exaggeration of their idiosyncratic behavior. So previously, maybe they were already an anxious person, but they are much more anxious nowadays. If previously they were a bit of an angry person, now they can't control their temper. The lid has seemed to have been lifted off. And then over time, they start becoming forgetful. So putting car keys somewhere and then not being able to find them, the famous one is you park your car somewhere and then cannot find it in the car park.
Okay.
Yeah, while this happens to all of us at times,
Yeah.
the person who actually is starting to develop dementia, we call it pre-dementia, will actually experience this regularly. Yeah,
Okay.
and then when dementia occurs, usually the initial presentation is the memory issues. So they stop being able to remember things. So they're managing finances is a problem, and kind of more high level activities of daily living are lost. So finances, going shopping, doing the housework, doing the laundry, so those are what we call instrumental activities of daily living.
Professor, but sorry to interrupt. There are some people who probably might just get this mistaken, being absent-minded, being forgetful,
Yes.
and having Alzheimer's or dementia. So it's two different, way off two different things, right?
Yeah, I mean, we have a lot of fun when we talk about these things. It's like, oh no, I keep forgetting.
Yeah.
Have I got dementia? We do know that there are a lot of conditions that will actually mimic dementia. So we call it pseudo dementia. And this happens when, let's say, you're very unwell, and you can have what we call a delirium.
Okay.
So that will seems like it's dementia, but when you recover from your illness, your memory comes back.
Okay.
So then it's not dementia. And then there is also like depression. So you're feeling very depressed, and your mentation is very slow. Then it would appear like you have dementia, but if we are able to treat the depression, then the memory comes back. So those are, we call pseudo dementia. But there's also the absent-minded fellas.
Yeah.
So there are people who have been absent-minded all their lives. You
Yes,
cannot
yes.
blame dementia.
Yes.
Yes.
So that's the one I've always wanted to know. Don't get it complicated or confused.
Yeah.
Because I know one or two of my friends who are in their midlife, or ever since I knew them from school,
Yeah.
just forgetful.
Yes.
Yeah,
Yes.
and then he did bring up this particular subject. Hey, dude, am I one of them who is getting into these stages?
Yes.
So I just did not know how to explain that to him.
It has to be
Confirm
something
it.
that was not like that before,
Right.
but has suddenly become a problem. Or previously it was a bit like that, but it's more exaggerated now.
Oh, okay, so those are the warning symptoms or
Yes.
those warning signs,
Yes,
and
yes.
probably should have your heads up on that. The difference between dementia and Alzheimer's, Professor.
Okay, so Alzheimer's is a type of dementia. And we
Okay.
always know Alzheimer's as the most common cause of dementia. So the figures are about 6 out of 10 cases of dementia will be due to Alzheimer's disease.
Okay.
But there are lots of other causes of dementia. So dementia is not really a single disease. But we tend to use it interchangeably. And a lot of the research we've done for treatment of dementia will be targeting Alzheimer's because it is still the most common cause of dementia.
Right, there you go. I'm very sure there's questions that probably our listeners will have. We have our producers behind the screens. So if you'd like to talk to us, well, we are on Facebook page, which is TRAXXfm, and on other social medias, we are on TikTok, we are on Facebook. So talk to us, ask us any questions. Probably you'd like to say hello to our professor right here. You can do so. We are live right now. And what we're going to do is we're going to take a short song break. We'll be back with more of these interesting questions that we have here for our professor, especially when it comes to dementia. We did explain the differences between Alzheimer's and dementia. And our topic for today, living in dementia. So stay tuned. Don't go anywhere. Back in a bit. It's Health on Traxx. Welcome to the show. Thank you so much for being here with us. Momentum on a Monday. Today's edition, the 3rd of March. And we are talking to our guest in the studio, Professor Dr. Tan Mo Pin, who's the head of Geriatric Medicine Unit, Universit Malaya Medical Center. And our topic for today, living with dementia. Now, the good professor did explain to us the differences between Alzheimer's and dementia, and of course, the basic fundamental points that we need to know what is dementia all about. Now, we had a very interesting topic also off air together with our professor here. And well, just to give you a little example, I had one of my aunts who is like 90 plus over, my late aunt who just passed away, but her memory seems to be fantastic, really, really good, especially thinking about birthdays and things like that. But the professor had something to say, which is otherwise sometimes your memory for long term can, I mean, it's like things that, which is, how would you want to put
Yeah,
this?
so a lot of my patients' relatives will be quite angry when we actually suggest that their loved one has dementia.
Okay.
So, because we will, when they come to hospital, if you come to the geriatrics ward, everybody gets their memory tested, and nearly all our patients will have a memory problem. Whether sometimes it's temporary because they're unwell, so they have a delirium, but a lot of times there is actually some memory deficits.
All right.
And so when we tell the relatives we think this person's got dementia, they get very angry because there's this stigma, isn't it?
Acceptance.
And also stigma, because
okay.
dementia is often, like, she's demented, she's nyanyot lah. There's a lot of stigma in society about dementia.
Right.
So but what is, they'll say, but her memory is so good. She never forgets anybody's birthday, and she remembered things from so long ago. Right. So just because they remember things from long time ago doesn't mean that their memory is good, because the things that are long time ago will be well practiced and well embedded in their brains, but they are unable to learn new things. So things they might not know what they had for breakfast. And their grandchildren, if you ask them what the grandchildren's names or what their great grandchildren's names are, they often can't remember. But they can even mistake their own grandchildren for their own children. So that often happens. But people tend to not want to think that they've got dementia because of this stigma. And also there's a general feeling that, just poor memory is very much part and parcel of old age. But we are now trying to tell people that any memory loss is not normal. And there's something now we can do about it. If you actually develop early memory loss, before it actually becomes dementia, because dementia can only be diagnosed when they start losing the ability to do to actually perform activities of daily living. But if they can still do all that, even though they're a bit forgetful, there's still a possibility of preventing them developing dementia.
All right.
Yeah.
So that gets into our question here. Now, as it's known, there's no cure for dementia. Is that right, Professor?
Yes. So far, when you read the textbooks, they will say that dementia is a disease of exclusion. So you have to exclude everything else that's reversible, and that and it is no cure. But we don't like people to think of it that way anymore. In fact, when we invest, that's why we want people to come forward as early as possible, preferably before it starts affecting their daily lives.
Right.
So because what we can do is we can do some investigation. So normally we will take a very detailed history to see how it affects you, know about what kind of risk factors you have, and then we will do some tests. And it usually involves a chest X-ray, an ECG, a blood test, to look for what we call reversible causes of dementia. So there are, for a long time we know about these reversible causes. And so they include things like vitamin deficiency, high calcium, thyroid trouble, so B12 deficiency, that's vitamin deficiency, some electrolyte problems, and medications. Some medications can affect your memory. So if we actually address those reversible problems, we cured your dementia. So who says dementia cannot be cured? But we also now recognize that even when memory deficits have occurred, we can actually change your lifestyle, and we should be able to stop the deterioration. And sometimes we even see some benefits, some improvement in your memory. So we usually hold our fingers up at this stage. I'm holding my fingers up, and there are 5 points. So if people remember nothing else, they must remember these 5 points. Number 1, brain exercise. So remember we said that education is an early life risk factors, but it's never too late. So we like people to always use their brain, exercise their brain. So some people like to do crossword puzzles, jigsaw puzzles. Nowadays you have all these online games that you can play to really exercise your brains.
Right.
But perhaps the best way is to actually, lifelong learning. Yeah, so learn a new skill, those sort of brain exercises. Number 2, physical exercise. Malaysians don't like physical exercise, but we're talking about physical cardiovascular exercises at least 5 times a week, each time 30 minutes, and resistance exercises 3 times a week. So you need to build muscle as well as endurance. And number 3 is actually your diet. Yeah, your Malaysian likes to eat all sorts of things that is not good for us.
Yes.
But we really need to watch what we eat. And the diet that we want are those full of antioxidants that will get rid of all the free radicals in our body that will cause the damage in our brains. So we are talking about fresh fruit, fresh vegetables, of which Malaysia has plenty, and then oily fish, things like salmon, mackerel, tuna, and of course for Malaysia you're talking about gembong, selah, the meat. The fish that has a slightly coloured meat, not white. Okay. And then the other thing that you could do is chronic disease management. So we're talking about midlife, making sure that your blood pressure is well controlled. If you have high blood pressure, diabetes is well managed. And also if you have heart disease, it's well managed. Chronic disease management. And finally, social participation. So in this day and age where people just, with a handphone, people do go out a lot less, meet friends a lot less. One of the things that we know that will really prevent dementia is if you continue to actually socialize, have lots of friends, have a good social network, that can really prevent dementia.
Okay, so those are the very important 5 points that Doctor has given. Probably that will prevent, I should say. Or,
yes, prevent dementia.
Okay, there you go. So the term of there is no cure for dementia. Well, not exactly as what Professor did mention. Professor, is dementia now? If it's dementia, what can an individual do, or besides the 5 points that you're given, is there anything else that probably could assist them?
Okay, so that's the other thing. So if you do have dementia, what we actually have, there is really no cure. There is actually treatment. Just like diabetes, there's no cure, but there's treatment. High blood pressure, usually no cure, but that we can treat it. So what we can do in dementia is to actually primarily do the lifestyle thing again. So we want people to actually have we want them to have a good routine. So they need to make sure to remember things. They need to put things into autopilot. So they wake up at around the same time, and have regular daily and weekly routines so that they can actually do things on autopilot. And then they need to still observe those 5 points that we mentioned earlier.
Right.
And then sometimes the thing that really troubles family members when it comes to dementia is the behavior. So they can be very impulsive, they can be very anxious, they repeat themselves. And then there's this issue of wandering and getting lost.
Right.
I think those are very familiar things that that happen.
Are those severe already?
It varies because because everybody's circumstance is different. Some people might get lost at a very early stage because they were already directionally challenged before, and then a little bit of loss already makes them get lost all the time.
Right.
But nowadays with modern technology, all you need is a GPS, and you can find them again. And also we want a dementia-friendly environment. So, signages that will help people get along. And then in hospitals, just volunteers that will try and tell people where they go. And those will help people with and without dementia as well. And then people to accept people with dementia in society and assist them with that little task that they can't do so that they can complete the whole tasks. So, for instance, if they can't cook because they consistently forget to add salt, all you need to do is to actually educate the family member not to stop them from cooking, allow them to cook, but make sure that You hide the salt so they don't add salt multiple times. And then when the dish is done, add the salt to make sure that it's adequately seasoned. Those sort of things.
Right.
And if the gas stove is dangerous, we can change it from gas
Yeah.
to actually convection. And then so it's actually very, very easy. So what we really need to do is educate the person living with dementia, as well as the person, the loved ones, to actually change the way they do things, to maintain their ability to continue to do things for themselves rather than take over.
Take it over.
Yes.
Take it away from them also.
That's right.
Yeah, don't do that.
Don't do that. And then there's also a need to plan. So as I mentioned, managing finances can be lost quite early in someone's lives. So and it's a very dangerous thing. So they need to actually make plans to make sure that they're financially provided for, and appoint, we call it power of attorney, to actually help them manage their finances, and then also plan for what happens if they end up in hospital. So a lot of times a person living with dementia, because we don't know they've got dementia, they end up having a lot of procedures done to them in hospital, when actually those procedures are no longer of benefit. So, and if they were able to make the decisions for themselves, they would have not wanted it. But if they're able to do what we call it advanced care planning, plan out their care, then they can actually continue to be able to make decisions throughout their treatment, rather than have a relative having to have the guilt of say, no, I don't think we should treat anymore. Those sort of very heart-wrenching situations. But if you made plans and told people about your plans, then these things, these treatments that are unlikely to be of benefit will not then be pushed upon you, because if the treatment is of no benefit and we still give it, it causes suffering and may prolong life unnecessarily. So there is actually a medication we can give people with dementia, and that enhances the memory a little bit. So we call it cognitive enhancers. So and those, you do really need to come forward to our memory clinic in order for you to actually get a prescription for these medications. But of course, now that we have more and more people living with dementia, because the population is growing older, we are also trying to make these drugs more accessible by actually educating general practitioners and family physicians to actually also be able to treat dementia.
Okay. Professor, I think we have a question here. This one here. Why we remember things many years ago, but forget things that just happened yesterday or last week? We were talking about this much earlier. Is there any explanation for this? I think Diamond Bay would like to know.
Okay. That's a very interesting and a very good question. So there's still a lot we don't know about dementia.
Okay.
Right. But this is a particular characteristic of dementia, in that they will remember childhood memories. And we, in fact, we use it as an advantage to our treatment strategies, because one of the treatment that we use is reminiscence therapy. Because for most people, not for everyone, childhood memories are pleasant memories.
Yes.
Yeah. So we actually have actually use things from their childhood to invoke a sense of pleasure and happiness in them. And so that will actually calm people with, we call it challenging behavior.
Okay.
And the theory behind why distant memory is lost less often is because we actually forget what we do on a daily basis.
It happens so fast.
Yeah, that's right.
Yeah.
But there are things that we keep as important things that we store. So those are the distant memory that we cherish. And so they are stored at a very secure part of our brain.
Okay.
And that will remain with us for as long as possible throughout life.
Right, there you go. So that explains your question here, Diamond Bay. Diamond Bay also wants to know any particular meds. Ada ubat ke?
Ada ubat. Okay, sekarang ada banyak ubat. Okay. So there are medications that you can take. I mentioned earlier that we call it cognitive enhancers.
Right.
So they generally belong to two groups. So one is choline esterase inhibitor. So those are the licensed for mild to moderate dementia. So if you come forward early enough, that's a medication that we will recommend.
Okay.
And for people who can't actually tolerate choline esterase inhibitors, there's actually a herbal remedy We call it ginkgo biloba, but there's only particularly one type of ginkgo biloba. We call it EGB761, which is a special compound that seems to also have a beneficial effect.
Right.
And then in the moderate to severe stage, there's another type of drug. We call it momentin that will actually we actually prescribe. And often a lot of our patients, because they come early enough, end up on both medications.
Right.
And these medications will actually enhance your memory.
Okay.
And they make a difference in the sense that because we don't really think about it, but care actually costs a lot of money. So either if your family members are supposed to offer care, take over some of the function of the older person with dementia, they lose income. Or if you are unable to meet that, you will end up paying for care. So we're talking about a live-in domestic worker, or a private nurse, private caregiver, or even long-term care. That means nursing home. Those are very expensive. So if you're able, but these drugs are actually able to reduce this cost.
Okay.
And so therefore we call it cost effective.
And the 5 points that you gave, practice those 5 points. Very important.
Yes, there will come a time when the dementia has actually progressed to a stage where we are changing our goals of treatment from trying to maintain their function and prolong life and reduce the progression to actually palliation. So that means they can do anything they like as long as they are happy.
Right.
Yeah, and that's palliation. And this is often what we forget, to actually, accept that actually death is an inevitability of life. In many countries, dementia is already the most common cause of death, especially things like places like the UK, Australia, and in some states in the United States, because the population is now so old.
Right.
And death shouldn't be something that we fear or we're scared of.
Yep.
And if we accept that, okay, I've got dementia, and yes, it's a good likelihood that I will die of this dementia. When it comes to a stage of life where I can already no longer do a lot of things for myself, and to pursue this life, this treatment to actually continue to maintain my function, actually adversely affect my quality of life now. Yeah, so people are forcing me to be active. People are forcing me to eat lots of things I don't like. No, let's stop that. Now I can start having anything I like to eat. I can just be as lazy as I want. Nobody's going to bother me. And I'm going to, and then the goals of care is to ensure that they are actually happy, the wishes are fulfilled, ticking off the bucket list, making sure that they have birthdays celebrated, and major occasions celebrated. And then when the time comes, when they get to choose whether they want to die at home or die in hospital. And whichever case, they will not be subject to treatment that is not going to be of any benefit, because and then they're allowed to have a painless death in a manner that they have planned.
Right. Thank you so much, Professor Dr. Tan Mo Pin. And of course, today's topic, living with dementia. It's so nice to have our listeners. Thank you so much for all the questions that you put on to us. And I hope Professor did make it very clear and accepting the way you are, the way we are. And yes, the last few words from Professor, that was simply amazing. All right. Thank you so much for joining us on TRAXXfm, second hour of the show. Health on Traxx, every Mondays, different days, different topics from Mondays right up till Thursdays. Thank you so much to my producer, Achu Azura. Thank you so much for being here with us. And it's a build-up to the midday news coming up in a bit. Thank you once again for joining us. Back in a bit. Stay tuned. TRAXXfm.